Hi again, it's Pam, and I'm here to talk about the question of the month for October. Can't believe it's October already. Okay, here's the question. Have you ever experienced stigmatizing language or behavior when engaging with any healthcare professional with about your HIV? If so, what needs to be done differently to ensure it never happens again? I don't know how much we can say never happen again. We can hope. Okay, first, I was diagnosed well over 30 years ago. So at the time that I was dealing with stressful and stigmatizing situations, there was a lot that almost everybody, 99%, didn't know. So I did experience, number one, the fear of going to the doctors, because I didn't want people to know why I was there. Two, because there was a time at the doctor's office, I was having a cold, I was congested, coughing, you name it, and then you get the looks, the stares, the sliding over, all these things that you fear that you be dealing with going to the doctors and then actually having them happen. They are a bit traumatizing. They don't help the stressors that we're going through at that time. It just enhances it more. Or how, when you're in the office seeing the doctor, but before he gets there or she gets there, you're dealing with the nurses and the PAs, and they too, though they're in the healthcare, doesn't always mean that they know everything. So you're getting different looks or feels or distances, or my God, they're covered up like a mummy, or don't want to touch what you touch, so all these things are stigmatizing. And I had gone through some of those situations and dealings way back when. I didn't know what to say. I didn't know how to handle it. I didn't even know how to deal with what I was dealing with as far as being someone, diagnosed with HIV. And I was fearful anyway, so why would I talk about it? I didn't want to say the words, the 3 letters I didn't want to say. Now let's move to where I am today. Fortunately, the doctors that I currently see, I have been going to the same ones for well over a decade. And so I have lucked out with the providers, the staff, and the healthcare facility, because I do feel safe when I go, and they are taking care of me, and they see me as Pam, who has a diagnosis, and we're taking care of it. So I thank God that, that's what I have today. Now, a couple of things I think could help if someone goes through this. A couple of things. One, something that we can do on our own, which is basically have a conversation. If you're dealing with a professional and you feel that they are at a distance, you don't feel that connection, provider, patient, because you're a team, and you feel that because of your diagnosis, they are treating you differently, I think a question to them would be, are you uncomfortable taking care of me? Are you uncomfortable being around me? Because if so, I would rather have a different professional, a different nurse, a different PA, whoever that person is. Because you are not going to the doctor so that you can feel like, you're not worthy to be in that office or be dealt with that professional. So approach that person, ask that question. Why, is there a reason why you are distancing yourself from me. This is how I feel. Maybe I'm getting it wrong, but this is how I feel. And start this conversation. You can approach a manager. I know they have patient advocates, a patient advocate, and speak to someone. That's one way that that type of situation can be addressed. The other is is basically having more training for staff, from the medical secretaries up to the providers, in training them for dealing with patients of all genders, of all diagnoses, and there should be a protocol with this. They need to know how to speak, how to refer to people. There's a lot to be learned. It's constantly changing, and they need to keep themselves up to date with what's going on. I'm a firm believer with that as well. But because that doesn't happen with the snap of a finger, it's really, I believe, up to us to get it going, and to keep mentioning it, and speaking up, speaking out, which is my motto. It's my new motto for like the past 5-6 years. I've been doing a lot more of that, because I guess I've just got tired of overthinking things, being afraid, and I'm done with that. So my thing is to speak up, have the conversation, have a dialogue, and it's your right to be seen by someone that you're going to feel comfortable with and have this working relationship, because it's to benefit you and your health. Okay, so that's my answer to October's question. Also, you can please visit our website, hivstopswithme.org, and you can always reach out to me or any of the spokesmodels if you have any other further questions, or to hear, what someone else is, how they're answering this question, and maybe get a little bit more information from them. Also, we have resources there that's throughout the whole New York State area. And what we do is we try to update that with the resources, whether it's health facilities or community-based agencies that we know have helped us, people like us, and we have that there for you. So it would be definitely worth your while to go and check that out, and maybe give one of those places a call if you find that they're in your area, and check it out. Don't stay where you do not feel comfortable or that you're getting the best health care. Okay, address it in any one of those ways. Speak up, speak out, find someplace else that's gonna make you feel good and be a part of a team for a very long time. So I hope my answer has helped somebody. That's all I can wish for and hope for. And also remember, 'tis the season for colds and flu. So please take care of yourself. Stay healthy. Get your flu shots, your new booster shots, which covers, all of them right now. I'm an advocate for that too. So be happy, be healthy. Okay? Take care, and until next time,